Sudden hearing loss is a mysterious ailment that can strike 1 in 5,000 people each year, but efforts are underway that can help lead to better treatment. I recently sat down with a local doctor involved in that work for today's In-Depth. Sudden deafness can be frightening, and usually this condition can occur in one ear. Has really no known cause. It might be temporary, but a quick treatment is always recommended. With us to talk about this condition and a local clinical trial to combat it is hearing loss expert Dr. Michael Seidman. Thanks so much for being with us.
Thank you for having me.
So first of all, how often does this sudden deafness occur? Is it quite frequent that you see it?
I see somebody at least once a week, and the incidence is about 10 out of 100,000. So it's more common than you think, and if you have a little party and you ask, you'll find that people said, oh, I had that happen to me.
Do people come in with a lot of panic? I would imagine they don't know what's going on.
The psychology behind this is amazing, because some people come in like, I mean, can you imagine, God forbid, you lost all your hearing in your left ear?
Right.
If you're born without it, you don't know any better. But when you lose it, when you're 20, 30, 50, 70, it freaks most people out. So it's scary.
It's recommended that you come in for treatment right away, as is many things. So is this a permanent condition? Can it become a permanent condition?
Yeah, so there's a whole long story, and I was part of the guidelines from our American Academy of Otolaryngology, head and neck surgery, fancy name for ear, nose, and throat surgeons, and we got 25 experts from around the world and sit down and group and figure out what to do with this. But the causes of this, really, we don't know, as you kind of alluded to, but they're either viral, vascular, or idiopathic. And viral means that you have a really bad cold. I mean, people get a horrible cold and then end up losing their heart and need a heart transplant. It happens. It's rare.
Okay.
So people get a really bad cold, a really bad sinus infection, and lose their hearing. And then vascular causes. So if somebody's an insulin-dependent diabetic, they've had 3 strokes, multiple heart attacks, you think vascular causes. And idiopathic is the medical term for we don't have a clue. And that really bothers particularly my engineering patients who say, you got to do better than that, doc. And then I tell them I can remove your head, take out your inner ear, and look it under a microscope. And in 30 years of doing this, I've had no takers so
far. Nobody's
No.
interested.
No.
How do you treat it then? So first you have to diagnose and see where it's coming from.
Precisely. Right? And we treat it primarily with oral steroids. So we think there's an inflammatory process going on as the end result, which bioinflammation are things that cause cancer, cause heart disease, Alzheimer's disease, you name it. We think that bioinflammation is a critical cause. And so anything you can do to reduce that inflammation, we think may help. But you know, a lot of patients say, so my hearing is gone, you can't get it back. And I kind of give them the analogy of being at New Smyrna Beach and you walk into the water and a shark comes in and bites off your arm and swims off. The likelihood of you seeing that arm again is slim to none. So even despite our best efforts, we don't have great treatments. And so the exciting thing for me is this new drug.
Yeah, so let's talk about this clinical trial. Have you had any trouble recruiting any patients to be a part of it?
Yeah,
or?
It's very challenging to recruit, because most people, it'll be a Friday afternoon and all of a sudden they'll say, gee, my ear feels blocked or stuffed, or I have some ringing in my ear, subtle findings. And you know, some people will put a cell phone up to it and say, gee, I can't hear anywhere near. That's an emergency. That's like having a stroke in your ear. And the problem is that even if you go to the emergency room or if you go to your primary care doctor, they may look and say, oh, you have an ear infection, and then, you know, 2 weeks later you get in to see me, and by that time it's too late. So this drug that kind of alluded to is called AM-111 Auris Medical, and they've developed a drug which actually blocks the inflammation and blocks cell death. So it's a very cool and exciting drug, really interesting data on animal models, and they have some very interesting data on humans as well. So if we can catch you within 72 hours, so Friday night you're going to a party, you think your ear is out, and then, gee, I'll wake up in the next morning, it's still out. Monday you call your primary care doctor, you're already out of the study. We got to get you in right away. So you got to really come in and see us, and you got to be aware that that's a real issue.
That's exciting that you guys are doing this.
It is a lot of fun. It's very interesting to have the opportunity to try to help people. So the drug is very exciting, and it seems to rescue this cell death and puts that arm back out. If you use my shark analogy, there's a chance and there's hope.
Thank you so much, Doctor.
You're very welcome.